to the latest social media live event hosted by the National Cancer Institute. My name is Sabrina Rahman, and I'll be your moderator for today's event. I'm the Deputy Associate Director of Digital Communications at NCI, and our group oversees digital engagement and outreach to the public. Today, on International Women's Day, as we celebrate the achievement of women across the world, I am thrilled to be joined by two amazing women and healthcare and science experts who are definitely breaking the bias in their fields. Admiral Rachel Levine, MD, who serves as the Assistant Secretary of Health at the Department of Health and Human Services, and Dr. Stephanie Goff, who is Head of Clinical Operations of the Surgery Branch at NCI Center for Cancer Research. As we get into our discussion with Admiral Levine and Dr. Goff about women in science and healthcare, we hope you'll participate and add your questions in the comments. Throughout the broadcast, we'll also provide links to resources in the comments section, and we'll try to get to as many of your questions as possible at the end. So that our experts are able to get to your questions, we ask that you keep them limited to today's topic. But before we dive into our discussion, I want to take a quick moment, Admiral Levine, to talk about a topic that's been in the news lately. Recently, President Biden announced the supercharging of the cancer moonshot, and many have been wondering what that means for the cancer research community. So what's the latest?
Well, thank you. It's a pleasure to be here, and thank you for that question. So President Biden and First Lady Dr. Jill Biden have reignited the cancer moonshot with new goals. Reduce the death rate from cancer by 50% over the next 25 years, and improve the experience of patients and families living with and surviving cancer. Now, these new goals are possible because of all that we have learned in the past 5 years, as well as the prior decades about therapeutics, diagnostics, and particularly patient-driven care, as well as the scientific gains and public health lessons of the COVID-19 pandemic. The President and the First Lady are announcing a call to action on cancer screening to jumpstart progress on screenings that were missed as a result of the pandemic and help ensure that everyone in the United States equitably benefits from the tools we now have to detect and to treat cancer. Now, we have made progress, but we want to end cancer as we know it. And we have many different pillars to do that: cancer screening, prevention, addressing those inequities, targeting treatments to individual patients, speeding progress with investments in new treatments, supporting patients and caregivers, and learning from all patients. So this is that newly reignited cancer moonshot that you mentioned.
Thank you so much for that overview, Admiral Levine. NCI is excited to partner with the White House and the entire cancer research community on these goals. So hopefully together we can definitely end cancer as we know it, as you so eloquently stated. Okay, so on to the discussion. Admiral Levine, maybe you can lead us off with this first question. Can you talk about your journey from where you started to where you are in your career today? How have you stayed resilient and confident despite the bias and discrimination women still face today?
Well, thank you so much for that question. I've had a pretty diverse career. So, I have been involved in academic medicine for much of my career, first at Mount Sinai in New York City, and then at the Penn State College of Medicine for 20 years or more in the field of pediatrics and adolescent medicine. And, very ensconced in academic medicine with clinical care, education, clinical research, and administration. But then I had the opportunity about 7 years ago to become the Physician General of Pennsylvania for Governor Tom Wolf, and then the Secretary of Health for Pennsylvania. So I made this switch, this transformation from academic medicine to public service and public health. And then a little over a year ago, had the tremendous opportunity to become the Assistant Secretary for Health in President Biden's administration, and the leader of the Public Health Service Commissioned Corps. I think that there are really one of the priorities of the Secretary and of the administration are to advance equity, inclusion, and diversity. I'm such a fan of the importance of diversity in all settings, whether that's a school, a medical center, government, and in every organization. And so we need to not just tolerate people, not just accept people, but we need to celebrate really people for the myriad tapestry of diversity that we see in our country, for the way it strengthens and enhances any organization. And it's because of that acceptance and welcoming environment that I have felt both in Pennsylvania and here that has allowed me to build that confidence and resilience over these many years.
Thank you so much. Dr. Goff?
You know, my career is not as long as Admiral Levine's. In many ways, I feel like I'm just getting started. I am a product of public schools, and I was fortunate in that I had a number of teachers who recognized the potential that I presented in the classroom, even though I was a little problematic and challenging at times as I struggled to stay busy. But every new opportunity that was given to me, you know, my mother just took advantage of pushing and making me see that intelligence and an education were the way to improve my lot in life. And so I was able to, I went to an engineering school first, went to Georgia Tech. It was very overwhelmingly male at the time. I think the ratio was 10-1 at the time that I attended. And then fortunately, I got into a medical school that was actually 50-50 men and women for our incoming class. And even though I chose general surgery as my residency training path, I had some incredible male mentors as well as female mentors that really just supported and pushed. And I think that, you know, having people see you and understand that you have something that you can bring, that reinforcement cycle is really what can keep people going. And I've had that throughout my training. You know, I've had fantastic mentors at Columbia, at Brigham, at Mass General, and now at NCI under Dr. Rosenberg. So I think that the gender of your mentor doesn't matter as long as they believe in you and they can help you build that confidence and resilience. And I've been fortunate to have that as I've moved forward.
Thank you so much. I loved hearing both your experiences and perspectives. Some of the words that came through were celebrating and accepting and welcoming environments and mentors, and how important mentors are in our path, in our journey, in our careers. So it's so empowering to hear these stories from women such as yourselves, and for women and young girls who are thinking about their futures, their careers. You know, it's not an easy road, but it's definitely a road that many have traveled, and seeing you guys as leaders in that area is definitely inspiring and empowering. So thank you for sharing those stories. So our next question is about leadership. What would you say is your leadership style, and how did you develop it? And then a little bit thinking about how it's different from the men in your field. Dr. Goff, we'll start with you on this question.
So, you know, I have the opportunity right now to be at the head of a very complex translational oncology program. And I think that the way that I got there is, I don't know if this is a real term, but I'd like to think of it as like 360-degree leadership. It's not just the doctor and the patient that's involved in something this complex. It is everyone. It is the med tech. It is the housekeeping. It is everybody involved. And as long as you continue to learn and build and ask questions of those people and they feel valued and respected, your entire program grows exponentially, because you can achieve more if you're working together as a family than whether you're being competitive with each other for results. And I think that, you know, that is something I learned by working with and for Dr. Rosenberg for this part of my career, and the opportunities that he's given me to be able to focus on that. I didn't strategically set out to become a leader. I just found the spots where things were needed to be done. And over time, as you gain an understanding and you earn the respect of the people around you, it just sort of naturally happened that I was allowed to elevate into this position at this time.
Thank you. Admiral Levine?
Well, thank you. You know, I believe in a transformational, facilitative leadership style. So my goal is to empower those that I'm working with to really reach their full potential. As Dr. Goff said, there really shouldn't not be any competition. We want to be collaborative. We want to coordinate together and to communicate. I've tried to take advantage of all the leadership training that I could get, both at the Penn State College of Medicine and then at the as Secretary of Health of Pennsylvania, through ASTO, the Association of State and Territorial Health Officials, and now, of course, in my position as the Assistant Secretary for Health. I think leadership training is important. I think leadership can be taught and can be learned. And I think that, there's lots of different ways to do that. And then also reading about leadership, I think, is really important. I've also really tried to learn from everyone around me. I use everything I've ever learned ever in these positions, whether it was from medical school and residency program through junior faculty, senior faculty, and on to public service. I really incorporate everything I've ever learned into these positions. I think my leadership style is different from men in our field. Now, as you know, of course, I'm a transgender woman, and so I have seen things from both sides, so to speak, and so I think it is different from men that I have seen. I think that I try to have more empathy and more patience sometimes than many men show. Although I have also seen fantastic, male leaders and mentors. I think one thing I've learned from clinical medicine is to compartmentalize. Is to be able to take emotions that you might be feeling and sort of put them aside to work through them later, but to be able to get the job done. I think you have to do that in clinical medicine, and sometimes you have to do that in leadership as well. Our ultimate objective is really always to help people. That's what I've loved about my career in clinical medicine and in academic medicine, and now in public health and public services. In the end, we're trying to help people. That's what the people working with you and for you are trying to do as well. And so the idea is to kind of go all to develop a consensus and all be going in the same direction for the common good.
Thank you so much. As I hear both of you speak about this, I hear this running theme of respect and collaboration and learning from one another. And it really feels like, to be a really good leader, you have to put your ego aside, that there's always opportunity to learn, always opportunity to grow, and that we can all learn and grow from each other. And the words you use, empathy, to help others, I think those are so important. And I feel good about the fact that I think we are getting to a more empathetic and kind world. And if we lead with those emotions, the world will just be in a better place. Obviously being in a leadership role can be both rewarding and challenging for anyone, but for women, those roles come with that added challenge of fighting to be treated equally to our male counterparts. That's just a reality many women still face today, and we are still fighting to achieve. So that's a good segue to our next question, which is around the question of barriers. What barriers do you think women face in the healthcare workforce today? And from your experience, how are women fighting through those barriers? Dr. Goff, we'll start with you.
So one definite barrier, and this is not one that I suffer from myself, but I see my friends struggling, is childcare, is rearing. It's the same problems that we've had in this country for so many years, because despite efforts to get to equal co-parenting, and it's still the responsibility of women in so many ways. I've seen it affect, not in medicine, but I've seen it affect my sister's careers. And I think that it's not that necessarily that we need childcare. It's that junior PI needs to have the funds, to have the postdoc, to have the technician, to have the biologist that can do the experiment that has to run until 10 o'clock at night. It's not necessarily that she needs someone to watch her children so that she can go do it. It's that she needs the proper funding that a young male junior PI would get, so that she can take advantage of that and become the manager of her laboratory, of her efforts. And I think, we run up a lot of things that are just systematic still. Being introduced as a conference by your first name instead of your title, being referred to in emails amongst colleagues by your first name rather than your title. And it's not a show of ego to want that. It's to want respect. to be listed side by side with a colleague who gets referred to as Dr. Y when you're referred to as Stephanie. It's those small little dings every day. And if you let those get to you, it can affect your, like Admiral Levine said earlier, you have to put your emotions aside and deal with that later, because that's personal, that's for you. It doesn't affect what you need to do in your workplace. But I think that there are still very real differences between funding levels, between percentage of people getting grants, and in academic leadership positions and in publishing, first authors and senior authorship. There's still just a lot that's not caught up yet and that's going to take time.
Thank you. Admiral Levine?
Well, thank you, Dr. Goff, for those thoughts. I thought that they're really important. It is unfortunate that this is still an issue in 2022, but there are undeniable barriers, and those have been exacerbated by the COVID-19 pandemic. In the spring of 2020, the Census Bureau found that roughly 3.5 million mothers with school-age kids either lost their jobs, took leave of absences, or left the labor market altogether. So the challenges are more than we've ever faced before. Now, as I mentioned, I'm a transgender woman, and that has had some interesting and unique challenges. I think that people sometimes fear the unknown, what they have not experienced. I think these issues sometimes of gender identity are new for people. And so what I'm trying to do is just to educate people, show that I am here in my position, working as a physician and in public health, working for the common good, and that helps people understand, and which can lead to more acceptance in that welcoming environment that we had talked about. Now, we have had really an onslaught of anti-LGBTQI plus bills in states across our nation right now. And those are, unfortunately, I think, politically based. And so we really need to empower LGBTQI plus people, and particularly right now, trans youth who are very vulnerable, and they need access to our support and to our empowerment. Luckily, we have a president and administration that have our back, and the president has articulated this a number of times. And he is just so supportive of women. He is so supportive of individuals in the LGBTQI plus community that it's refreshing and it's empowering to see him there having our back.
Thank you so much. You both bring up some really important topics, really important issues that we still have to grapple with. But it reminds me of the famous quote by Dr. King, where he tells us that whatever we do, we have to keep moving forward. So we keep trying, we keep going. So sort of channeling Dr. King's desire for equity, our next question is, I'd like to understand your thoughts on how we can promote more diversity and inclusion in our workplaces, especially as women in positions of leadership. Admiral Levine, we'll start with you. What changes do you hope to see during your tenure in your position?
Well, as I mentioned, I think that equity, inclusion, and diversity are absolutely critical in all aspects of our society, whether that is in government, whether that's in business, in academic medicine, in healthcare. Diversity, equity, and inclusion are critical. And I think that we need to take a multi-pronged approach to creating that more equitable future, which the administration is working on. The president has called for passage of legislation such as the Bipartisan Equality Act, to strengthen the Violence Against Women Act. And so we need to work towards a future where women's rights are more protected by law, because they are under siege in many states in our country, as well as rights and equity for the LGBTQI plus community. We need to look at some of the underlying stresses that we're seeing in our society. That includes mental health issues, that includes addiction issues. And that is all part of it was all part of the president's State of the Union address and all part of his agenda. So we need to use every tool in our toolbox. We need to use all those tools as we work on diversity, equity, and inclusion in all aspects, whether that is race, ethnicity, primary language, sexual orientation, gender identity, all genders, geography, disability, the social determinants of health. So that's what I'm going to dedicate myself to working towards with Secretary Becerra of HHS and the administration.
I think one thing that we need to think about is there are obviously so many wonderful programs that have been put in place, both at the NCI and both more broadly globally at the NIH and through the legislation that Admiral Levine referred to. But I said earlier that my mom, she's a retired school teacher, as well as my wife is an educator. We have to start earlier. Watching my nieces and nephews who are range from 3 to 16, there's a moment where they switch and they decide which direction they can go. And it's not throwing money at MD and PhD programs and trying to promote diversity and equity there. You've got to start earlier, or else the children don't have the tools they need to take that step. Now, clearly, this is way out of my field of expertise. It's just my experience as an aunt. And someone who loves children very much, watching them go through this struggle of loving science and then losing it because they're told that that's for boys. And we've got to work earlier, and knowing that it's going to take a long time to see the fruits of that labor, but earlier and earlier in helping children achieve that equity.
Well, as a pediatrician and adolescent medicine specialist, I agree with you completely. I think the key is empowering our youth to be who they are and to shoot for the moon, literally and figuratively.
Absolutely. I mean, this is such an important topic, and it's definitely a priority for NCI as we work on our equity and inclusion program, and of course for many organizations across the country. Hopefully we'll see the much needed change very soon. Before we turn to questions from the viewers, I have one last question for both of you. What advice would you give to your 25-year-old self? Dr. Goff, do you want to get started?
Don't change who you are to please somebody else. The people that can see you, that can see the real you, they're going to find you. And you will find your way.
That was beautiful. Admiral Levine?
Well, thank you. That was almost 40 years ago. So, I would say that to stay calm and centered, and because your life is going to lead you down a lot of unexpected roads with many transitions. I kind of specialize in transition. You might not end up where you expected, but you're where you were meant to be. And so that's what I would tell myself at 25.
Oh my God, I am so inspired. I have 2 daughters myself, so I'm very, very hopeful for their futures, knowing the path women like yourselves are paving for them. There's definitely a lot to be proud of and hopeful for. So thank you so much for your thoughts. So I'm going to turn to questions from our viewers. We have time for 1 or 2. The first question here is, what would you advise someone who feels like an imposter in their setting? Admiral Levine?
Again, to stay calm and centered, we all sometimes feel like that. All of us sometimes feel like, how did we get to be here? And maybe we don't belong here. I still have dreams at night that I didn't study for the test and I'm going to have to take the test or whatever. So I think that happens to all of us. So, I think that's where you have to compartmentalize it. Put those doubts over here, and you'll work through those later, and then do what you need to do to be able to, again, work towards the common good in whatever field you're in.
Yeah, I think I wish I'd known about imposter syndrome earlier, because I thought it was just me. Once I learned that it was a real thing and lots of people, particularly women, felt it, I was able to overcome it a little bit more.
Absolutely. You are not alone. I think that's important for everyone to remember. The next question here is, are there any people you've looked up to throughout your career? Dr. Goff, we'll start with you.
I got very lucky. I got to work for mine. I trained under Dr. Rosenberg for 4 years learning science and immunology. And then I got to come back and be on his staff and now help run his clinical operations. So um, he has really been a touchstone for me. He's a transformative leader, and he really helped me see my full entire potential.
Well, I have had a number of different mentors throughout my years in academic medicine and now in public health. So first during my training at Mount Sinai, one person I would highlight is Dr. Angela Diaz, who's now a dean at Mount Sinai for global health and equity, and she's also an adolescent medicine physician, and so that's someone I've looked up to. But then others at Penn State. Dr. Barbara Ostroff was the chair for a number of years when I was there, and I looked up to her. And then others in public health. So always had mentors, women and men, to look up to and to help motivate me and stimulate my growth as a leader.
Thank you. I think you both underscore the importance of mentors and a support network for anyone, men or women. So thank you for your thoughts on that. Quick final question is, how do you succeed in a male-dominated field? Admiral Levine, we'll start with you.
So again, I have a very interesting perspective on this question, being an openly transgender woman. I have never really thought about gender from that perspective. I've obviously thought about gender a lot from many other perspectives, but in terms of limiting me in any way, I have always had specific goals that I've been working toward. Of course, they shifted from academic medicine to public service and public health, but I never let that actually limit my goals and aspirations in any way.
I think I took very much the same approach as Admiral Levine. I can't remember ever thinking, I can't do that because I'm not a man. Whether that was general surgery, whether that was surgical oncology, whether that was coming into a laboratory setting. And I think if you take that mindset and push forward with it, people will see you're not going to put up with the usual things that some women will put up with. I know that many of my colleagues have felt the brunt of that, the belittling comments, the sexist nature of an OR. But if you take a stand and you're not going to fight for it, or you're not going to put up with it, it will stop. Surgery is still very much a male-dominated field, but anybody who peruses Med Twitter or the Academy of Academic Surgeons or any of the big organizations, women are catching up. So the work that's been done in the last 20, 30 years is really starting to show with the leadership that we're seeing. One of my mentors, Dr. Monica Bertinoli, was the first female surgeon to run the ASCO, which was a big achievement. And so, women are starting to they're putting their flag down. They're making their mark known. And it's because of the tremendous strides forward that have happened over the last 20, 30 years.
Absolutely. I think, the message there is it may not be easy, but it can be done. And we have to keep going. We have to keep moving forward. Yeah. So that's all the time we have today. I want to thank you all for spending time with us, and especially thank our experts for sharing your stories, your expertise, and advice. Admiral Levine, Dr. Goff, is there anything you'd like to add before we sign off?
Just believe in yourself. You can do so much with that, believing in yourself first.
I agree with that completely. Believe in yourself and work for the common good.
Thank you so much. That's a great way to sign off today. But before we do, I just have 2 requests for our viewers. First, as a result of COVID-19, I'm sure you're all aware that our nation and hospitals are facing a severe shortage of blood supply. In fact, it's the worst we've seen in more than a decade. For people with cancer, this is an emergency. Cancer patients use nearly 1/4 of the blood supply, more than patients fighting any other disease. Over the years, millions of people have proudly rolled up their sleeves to donate blood. The pandemic, unfortunately, caused many blood drive campaigns to pause, and now the NIH Blood Bank, the American Red Cross, and other blood donation centers need our help. For those who are eligible, and if you can, please consider donating. To register to donate blood, you can visit the NIH Blood Bank website if you're in the DC area, the American Red Cross website, or schedule your appointment at any blood bank center of your choosing. If you're unable to donate blood, please consider supporting your local blood donation centers in any way you can. And lastly, over the course of the pandemic, we've seen a distinct drop in cancer screenings across the country. I think Admiral Levine mentioned this at the top of the hour, that cancer screenings have gone down, but we have to make sure we talk to our doctors about any cancer screenings that we may need. So I urge you to please make that appointment, talk to your doctors. Screenings can save lives. That brings us to the end of today's event. This video will appear on NCI's Facebook page and will be on our YouTube channel as well. If you have further questions or need help finding cancer resources, please call our Cancer Information Service at 1-800-4-CANCER. That's 1-800-4-CANCER, or visit cancer.gov/contact for live chat. Thank you all for tuning in today. We look forward to seeing you next time.
U.S. Department of Health and Human Services, National Institutes of Health, National Cancer Institute, cancer.gov, 1-800-4-CANCER.